Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm here to provide the district's update on our response to COVID-19. Today, I'll make some general updates and then provide an update on testing and unemployment benefits. I'm joined today by several members of my cabinet. Director Smith, Director Nesbitt, Director Gelthardt, and Director Morris Hughes. This morning, we reported 108 new positive cases in Washington, D.C., for a total confirmed case number of 3,206, and sadly, we announced 15 deaths. What the numbers tell us is that we have made progress, but we must keep working to flatten the curve. We need Washingtonians to continue to stay home, to practice social distancing, and to wear a face covering when you go out for groceries or other essential services. I also want to share the most recent numbers related to our skilled nursing facilities. I shared some of this information with you last week, and I want to also share the most recent numbers. There you notice skilled nursing facilities all across the District of Columbia. We remain very focused on how we protect residents in nursing homes and other congregate settings. Since last week, we have taken a number of steps to continue to support our long-term facilities, including 5 site visits at 3 facilities, 2 PPE trainings, infection control assessments, and daily phone consults with our epidemiology team at the Department of Health. Today, we also have a new shipment of PPE going to nursing homes, including almost 30,000 gowns, 9,500 face shields, and 17,000 masks. Last week, I provided a comprehensive update on our vulnerable populations in the district, and I said that one of the actions we would be taking is deploying some of our new rapid point-of-care instruments to these congregate care settings. So I want to provide a brief update on that. I also want to recognize that this week is National Medical Laboratory Professionals Week. That's you, Dr. Smith, among other things. And your team over at the Department of Forensic Sciences, which includes the district's public health lab, which many people won't remember, but it's a fairly new entity in Washington, D.C. I think 5 years ago, or now 6 years ago when I became mayor, we had a fledgling public health lab, and under Dr. Smith's leadership and the support of the D.C. Council, we have been able to make incredible investments in the district's health lab. So thank you for your leadership there.
Thank you.
Her team is working long hours behind the scenes, 7 days a week to support COVID-19 testing in our city, and we are very grateful for what they're doing. My first testing update is around our rapid point-of-care instruments. We've talked about these. I'm sure you've read about these instruments in the news. The rapid Abbott ID Now, and we plan to deploy these instruments to be used in 6 homeless shelters, or I should say 6 to be used in homeless shelters, 2 at our DOC facilities, 2 at St. Elizabeth's Hospital, 1 at Tamari Center, and also at least 1 going to long-term acute care and skilled nursing facilities. This week, personnel at these facilities are being trained by DFS, and the instruments will be delivered later in the week. The goal is not to replace the other methods of testing that are available, including larger sampling that could be sent to the public health lab, but it adds another tool that will help in the strategic decision-making around quarantine and isolation at these facilities and give the people there immediate access to those tests. Second testing update is that tomorrow we are opening an additional public testing site in addition to the UMC site that is supported by the District of Columbia. We will be adding a site at UDC at the Bertie Backus campus in Ward 5, which is just across the street from the Fort Totten Metro. This site will be open on Tuesdays and Thursdays and will operate like the UMC site. It will be walk-through and drive-through. Residents need to schedule an appointment, and to get an appointment, they would call 1-888-363-0333. So we continue to look for ways to expand testing, and this is an additional way to do that. In addition to opening this new site, DC Health is expanding the criteria, priority groups for testing to allow some asymptomatic individuals who have a history of exposure and are in high-risk groups to be prioritized for testing. So we're making the eligibility requirements broader and adding the site at Backus. And I know that Dr. Nesbitt would want us all to remember if you have COVID symptoms or otherwise feel ill, and if you don't even think there are COVID symptoms but you feel ill, you want to reach out to your doctor or call your testing hotline. Even if you're not coughing or you don't have a fever but you don't quite feel right, talk to your doctor and let your healthcare professional help you decide about testing for COVID. Before we turn to questions, we want to give a brief update on unemployment benefits. Last week, I told you that we have dramatically increased the number of call takers at our DOES call center. And here are some of our latest numbers. Since March 3rd, DOES has paid over $90 million to nearly 34,000 people. DOES has started paying out the federal pandemic unemployment compensation, or PUA. The additional $600 per week is part of the CARES Act, and that is reflected in these totals. You see here a weekly assessment of the number of claimed files, the number of claims filed, and of those claims, the number of individuals paid by week. So we continue to work through all of the people who have applied and are awaiting assistance from unemployment. And Dr. Morris Hughes will go through and also be available to answer any questions, and particularly talk about frequently asked questions that we're getting and frequently encountered problems that we're seeing with some of the claims that hopefully we can avoid when people are filling out their claims. So that's where we are with unemployment. We told you that actually I think that we're a couple of days ahead in being able to accept the PUA. So I want to thank all the men and women at DOES for the hard work that they're doing. I had a chance to walk through the call center last week, and we appreciate volunteers from DC government that are pitching in with their colleagues at DOES. So thank you for that. We also want to make employers in the district aware this week that they can apply for the shared work program. And Unique can talk a little bit more about this, but this program basically allows employers to avoid layoffs by reducing hours and sharing what is left of the work amongst all employees. Employees can then collect unemployment benefits to replace the part of money that they lost with reduced work hours. So this allows the employees to keep their jobs and continue to access benefits, and it helps employers avoid the cost of having to rehire and train new workers. And finally, I want to share that workers will be able to apply for PUA, the Pandemic unemployment assistance through DOES by Friday, April the 24th. This is going to provide financial relief to people not otherwise eligible for regular unemployment. I think the last time we were here, I showed you the big pamphlet that we have around unemployment that asks a lot of the frequently asked questions that answers them, and that is available on our website at coronavirus.dc.gov. But it very clearly lays out the difference between what we call traditional unemployment and the pandemic unemployment that is added on as part of the Federal CARES Act. So if you don't have that, please go to coronavirus.dc.gov to download that pamphlet. So we know that the PUA will provide relief to people that would not have been eligible for regular unemployment. They include gig workers, independent contractors, self-employed individuals, church employees, nonprofit and government employees, and those who have exhausted their regular and extended benefits. So, and it's an additional $600 per week, I think, for 13 weeks. For 13 weeks. Individuals who wish to be notified when the system is able to receive applications, so we say that should be on April 24th, you can email us at pua@dc.gov. So again, I want to remind everyone to stay home, to reach out to a healthcare provider or a testing hotline if you feel sick. And I will share more information about how we will eventually reopen parts of our city and parts of our economy as early as this week. I will be able to talk to you about our planning to get that done. So with that, we'll take any questions. Yes.
With this new protocol now allowing asymptomatic people to get tested, what kind of demand do you think this is going to put on the testing site? And is there enough testing kits out there to handle that?
Great question. So right now, we have reported a 500 sample per day capacity to do testing with our main high throughput capability. We also have a capability that we can utilize that would give us an additional 150 samples per day should we need that. We haven't ever reached that max capacity. As to our supply of test kits for those, I have some numbers. So currently we have 6,560 tests available and for the high throughput system, with another 1,440 coming to us. For the 150 sample per day platform tests, we have 1,089 tests available and 2,200 tests coming to us. So we have a lot of supply to move through this. We're really excited about the opportunity to do this additional testing in support not only of the drive-thrus, but also other individuals who may be sending samples to our laboratory.
Is that a problem that you're having?
Yes, another great question. I actually have some information on that. We put together kind of what we call sampling kits, which involve swabs and media and tubes. We have distributed many of those kits out there to the drive-in sites already, so we have an additional 1,477 on hand. We have 10,378 sterile swabs and 1,500 tubes of the media to compile more kits. We also have additional 11,400 swabs to be delivered to us, as well as the media. So, you know, this is always rolling. These supplies continue to roll in, and we have had great support from the ops folks here in the city to go out and find swabs, find this media. So for now, we believe we can meet this additional testing that it needs to be done and sampling.
Do you have a model that shows what kind of demand you're going to get with the asymptomatic people?
So I'll take that. We want to make sure that people understand who we're talking about when, as the mayor described, we want to be able to provide testing to some of the targeted populations who are asymptomatic, who we think may be continuing to contribute to some of the ongoing transmission that we are seeing in the district. Some of our assessments of our data indicate that we may have individuals who are household contacts or are congregates in, who are residents in some of our congregate settings, who may be asymptomatic but are continuing to be in close proximity to other people. And because they have been close contacts to COVID positive individuals but do not have symptoms, they may not necessarily be doing all of the quarantine things that we need them to do, or if they were tested, they may have a better awareness of their actual COVID status and could be reducing the transmission or spread to other individuals. There are also individuals who may be in some of our high-risk groups who are asymptomatic or who may have an atypical presentation of COVID-19, who we want their healthcare providers to have a much lower threshold for testing those individuals, because if they have COVID-19, then they're going to have a more complicated course of their disease. And if it goes undiagnosed or it goes missed, then that is a real detriment to that individual and our community as well. So prioritizing asymptomatic individuals who are over 65, who have underlying health conditions, who are healthcare workers, those are the groups who we really want to focus on for asymptomatic testing. We're not in a position at this time where we are asking for all asymptomatic individuals in the community to push into our system and ask to be tested. We're really focusing on those individuals who are close household contacts, who are in congregate settings like our skilled nursing facilities, who are quarantined in our Department of Corrections, who are on quarantine units in our skilled nursing facilities and our St. Elizabeth's, for example. We're going to be really focusing on those populations in the immediate term and long term, and then focusing on those high-risk populations who may have a more complicated disease course.
Follow up with Dr. Smith one more time. So these 10 sites now, how many of these test kits that are actually completed come back to your lab?
So, are you talking about the Abbott?
So like George Washington University, Children's Hospital,
Oh.
places like that, are they sending those out to private labs or are they coming to you?
Yes, so that's a great point that I should have added. We are assisted in all of this testing of DC residents through commercial laboratories, through healthcare providers who send them to the commercial labs, or through some institutions like Children's who actually have laboratory capabilities and do most of their own testing. So there's sort of three components helping with the testing, not just the public health lab.
Mayor, we're looking at 8th Street today, and this is obviously an area of lots of bars and restaurants and greatly affected. How do some of the programs, I guess, that you and Dr. Hughes are talking about today, how does it affect people there? Because I guess these were tip workers, people that own restaurants, things like that.
Dr. Morris Hughes?
So I'm
my
happy to
bad.
answer.
My bad. Oh, it's my bad.
First, and this is something we're really proud of because we are one of a handful of states that have been able to deliver this. But this week we started making the FPUC payments, which is the additional $600 a week. And so many individuals started receiving that as early as Tuesday. So for our tipped wage workers, for folks in the hospitality and tourism industry, they're now receiving an additional $600 a week on top of our maximum weekly benefit. And if you are eligible for the full amount, that exceeds over $1,000 a week. So those, that is cash in hands to hand, that will help individuals immediately. So that's one. Two, the shared work program is an opportunity for restaurants, coffee shops, anyone who is looking to not lay off their staff completely, but to reduce their hours and wages and then leverage some of the federal unemployment insurance benefits that are available. We think it's another economic support that can help many of the businesses that are on 8th Street and across the district.
Mayor, Vince Chillibo got quite a bit of attention recently, basically saying they kind of lost out in terms of the federal program. Is there something the city can do to help them, or is there anything in the works there?
Well, certainly, the Ben's Chili Bowl is the type of business that should be helped by the federal small business loans. And I know that the Congress, I think the House will vote tomorrow, if not today, on the package that will re-up that program. So small businesses that are in line for funding, when the funding ran out, would have the opportunity to get those loans. Ben's would have also been eligible for our small micro grant program. I'm not sure where they, if they applied for that, but those are the reliefs.
Also, Mayor, you were looking for, I guess, another $700 billion for, I guess, what DC lost out last time. Didn't happen in this particular bill. What are your thoughts there? Any comment on that?
When you say I was looking for, we are looking for the 702,000 of us who pay taxes here, more than 22 states, just like every other American in the states. We who live in the nation's capital, where, you know, there's the White House, the Congress, and 20 million visitors that come from all over the world to visit our nation here in the nation's capital. And we who have a disproportionate impact of this virus on very vulnerable people and African Americans, we need the money that we're owed. And just like we are treated for state as a state with every other funding formula and every other part of an emergency response, we need to be treated as a state in this case. Now, everybody involved from the administration, the Congress, tells us that it will be in the next one. It'll be in the next one. And I believe that they still have an opportunity for a technical fix to this one. This one is focused on small business and hospitals and testing, which we support and agree with, but there needs to be a fix to this designation as a territory.
So you have any hope that this will be ultimately included, or what do you think?
I think that DC residents have to keep fighting, and we all have to keep fighting for CARES 4 or 2, whatever you want to call it, which is the next bill that everybody keeps promising. Yes.
If I could follow up on some unemployment questions. Can you clarify, I know I've asked before, but just if I'm a Maryland or Virginia resident, but I work in DC, or I'm a gig worker, perhaps I live in one jurisdiction and I actually collect income in 2 or 3 different jurisdictions, where do I file?
So let's start first with the first part of your question. Unemployment insurance benefits are based on the location where you work. So if you work in the District of Columbia, you're to file in the District of Columbia. If you are a gig worker or 1099 and you collect wages in multiple jurisdictions, that's a bit more complicated. And so we ask those individuals to email us at pua@dc.gov to help go through your specific situation or circumstances. But as a general principle and rule, it's based on the location where you work.
Does it matter if again, if I'm in multiple jurisdictions, should I apply where I earn the most? Is it one flat?
So this is why we ask individuals to email us, because we have often found through some of these questions that there are folks that have really complicated situations. And so it's best to talk about your individual set of circumstances with one of our claims examiners.
And then on the shared work program, is that something that's new because of this, because of the pandemic, or is that something that was always available to employers through unemployment?
Sure. So the shared work program has been around for a while, but as a condition in the CARES Act, each state had to agree to implement and communicate to the general community about the shared work program. So there is an increased emphasis and a heightened awareness on the shared work program because of the CARES Act, but this is not a new program.
And then I have a couple questions on St. Elizabeth. I don't know if you want to address these, but we've now seen today, I think we've reported the 6th death at St. Elizabeth of a patient there. I'm just wondering what you can tell us about what's happening. There's been a lot of focus on the jail of late, but there have clearly been more deaths at St. Elizabeth. What can you tell us is happening there? And then can you clarify for us, because Councilmember White has said that his grandmother died from COVID. She was an employee at St. Elizabeth's, but she is not, you have not listed a death of an employee at St. Elizabeth's yet. I'm just wondering if you could kind of square that circle for us.
Well, Councilmember White never told me that, and we haven't gotten that confirmation from any authorities in Maryland, which is why we have not listed the death of a St. Elizabeth's employee. And I'll ask Dr. Nesbitt to talk about St. Elizabeth's.
Yes, so I believe last week we referenced that while our epidemiology aid or assistance from CDC was in town, in addition to them providing us support and technical assistance with our long-term care facilities, we requested that they provide us on-site review of the policies and infectious control procedures that were in place at St. Elizabeth's as well. While they are classified as a hospital, we do believe that some of the things that they encounter as a congregate care facility or a long-term care facility could be applicable. So they did have a site visit with the healthcare facilities division and the epidemiologists who do infection control at the DC Health with the CDC on Friday. And we did receive some feedback. Most of the infection control procedures that St. Elizabeth has for their isolation unit and quarantine unit were in consistent with CDC guidelines. There were not identified many areas for opportunity for improvement. One of the things that was announced today is that having more access to point of care testing would be an improvement that we can make. They are scheduled for some training to be able to use some of the point of care testing that we now have access to, with more test kits being made available just in the last actually 6 to 7 days. So we'll be able to put them online with that capability. What the point of care testing does is it allows for more timely isolation of individuals who have signs and symptoms, more quarantining of individuals who come into contact with those residents. The assessment also help to do some observation of how the staff who do have access to personal protective equipment actually don and doff and use that personal protective equipment. I think we've talked here a lot about how we are making personal protective equipment available to healthcare professionals, but one of the things that we know is making available personal protective equipment is only one part of the equation. How they actually use that PPE appropriately is a critical part of the solution, and so we were able to make some observations there.
And let me just go back a little bit, Mark, because sadly we've had several of our employees impacted by COVID who have died. We've had others who have been infected. Some are recovering at home, others in the hospital, and others with quarantine. And so we have created a system in each department of how, and this is my expectation of all the directors, which I have discussed with them directly, that we're helping to follow our employees. Some of our folks have been out working at home, teleworking since mid-March. And we have to have a way to kind of check in on them to see how they're doing. And others we have found out have tested positive, and we found out that others have been hospitalized. And so we are working very hard to be able to keep track of our employees, those who are reporting to their workplaces, and those who have been on telework. Their directors each are coming up with a system to do that. But also in the unfortunate event that we lose one of our employees, our Office of Human Resources has a liaison that is very much in touch with families about our employee who has passed away. So regardless of a cause, we have these systems set up to support our employees. I think we've reported that already.
Can I ask you just another question? One of the kind of side things to this is that a lot of people are using these Zoom platforms and online platforms for happy hours, family get-togethers, and government meetings as well. And we're seeing some impact there from people who were, I don't know if the term Zoom bombing, or, you know, these groups that kind of invade these with either pornography or other inappropriate video during these meetings. Have you encountered that, or what are your thoughts on that? Do you have any guidance for citizens with government on that?
Well, I don't think that the government is we aren't using Zoom on the recommendation of our OCTO, of our Chief Technology Officer. We have a different system in the government that we're using. I understand that it's clunkier, and so a lot of people prefer Zoom to this one, but that's the one that we have determined to be more secure. There are other agencies, obviously, in the government that are independent of us that will make other decisions, but I make available. And we had a very unfortunate incident with the Public Charter School Board in a public meeting. And so this is an example of an independent agency that I want to make sure that they know that they can call on us for advice or assistance with their technology needs, especially now, when all of us are trying to figure out how to do our normal business in a public way and engage the community. So we would offer the Public Charter School Board the assistance of our Chief Technology Officer, and if they needed access to some of our licenses, for example, to help with doing that. We've also confirmed that our Metropolitan Police Department will work with the FBI, and Dr. Smith will know about this because this was evidently horribly child pornography involved in the Zoom bomb, and the FBI has a special task force that helps with that type of internet investigation. So I hope that they find the person responsible for this.
No discussions of ongoing investigations.
Yes.
I have a question for Dr. Morris Hughes and a possible follow-up on that to the mayor. Could you tell us the status of the Summer Youth Employment Program?
So I love the Summer Youth Employment Program as much as the mayor does. We are still planning, but we're looking at different options. We're looking at different virtual and hybrid options, but it's still part of ongoing discussions with our Deputy Mayor of Education.
Mayor Bowser, I understand that in the budget process there are no sacred cows. However, the Summer Youth Employment Program is a very popular program in the city. And as your budget team looks at the upcoming budget, do you have a sense of where you're going in terms of that particular program?
Well, let me just say this. We don't know where we're going with summer. Okay, and so, and I think you were here where we talked about being able to follow where we are on the ground. And if we see our numbers going down with positive cases and where we are with reopening. And this is not a laughing matter, so I don't mean to joke about it at all. But the course of the virus is not really a budget question as much as it is what are we going to be able to do in person this summer. And that's what we will continue to work on. This week, we expect to get the budget revenue numbers from the CFO that he will certify as revenue coming in, and that will inform a lot of the budget decisions that we will have to make. I mentioned previously that by mid-May, we hope to come back and talk specifically about our in-person opportunities for the summer. That includes in-person summer school, or will it be a virtual summer school? What we're able to do with our parks, recreation, and camps, as well as our summer youth program. Amanda? From the City Paper? Are you there?
Hi, yes I am. Thank you for taking my call. Just 2 questions today. The first is, do we have enough hotel rooms now that DC is testing some asymptomatic patients in congregate homeless shelters? Last we heard there were 5 hotels reserved for quarantine sites, so now I'm wondering how many rooms we have. leased now and how many are occupied?
Director Geraldhart?
I do believe that we, with our current capacity that we're looking at in the hotels for those that we need to isolate or quarantine, we are at a good position for that. We're also looking at things within our shelter systems on how we can better handle some of that capacity by gaining some additional space inside the shelters as well. So I think we're in a good place now. You know, the numbers are what they are. So as we go through the testing and we see how our cases move along, we're hoping we're doing the right thing by what we're doing now, and we're seeing that pay off for us in stemming the tide at our homeless shelters and our vulnerable populations by putting in place the availability to move folks out of those congregate settings when we believe we may have increased cases going on. So we're seeing some positive things there, and I think we're in a good place to go forward.
Thank you. Did you have another question?
Thank you so much. Yeah, just one more. Individuals who are being released from DC jail in St. Elizabeth, are they being connected to housing, or are you recommending they go to emergency shelters? What's happening there?
Well, in general, we work with people being released from DC jail with our Ready Center, and Ready Center is operating, and that is to make sure that we are connecting residents with all of the benefits and services that they are eligible for. So all of our DC jail releasees would go through the DC Ready Center. For St. Elizabeth's, the Director Bajron, is working on supported community placements, and people would not likely be released from St. Elizabeth's without those supported community placements. Sophie from the Washington Times.
Yes, hi. Hi, Mayor.
Hi.
My first question is, what metrics are being used to determine when restrictions will be eased, and how close is the district to meeting those metrics?
Well, Sophie, I think that we've said a number of times that we thought that the framework laid out by the White House task force with various phases that a community would go through that demonstrated that the level of positive cases was decreasing, that testing capacity was sufficient, that hospital surge capacity or hospital normal operating capacity was sufficient, are all benchmarks that we are going to look to. However, we will lay out a formal policy about talking about all of the steps that we need to reopen in the coming days.
And then my next question, is the DC Public Health Lab, are they doing any antibody testing?
Dr. Smith.
We are gearing up to do antibody testing. We are waiting for EUA approval of an antibody test that will provide the types of data that we need to make those types of decisions. So we believe right now we should be ready to go by the 1st of May.
So we're working right now. We've assessed a number of clinical partners who would be interested in helping us to test eligible people in the district. The point of antibody testing is to be able to identify people who have had a past exposure. So the criteria would be a much more larger segment of the population. Of course, there are still some of the same barriers for a lot of the healthcare community to be able to offer this testing. Many of them still will have the same needs for personal protective equipment. We would love to be able to have as many healthcare organizations participating in providing this testing as possible, but our early surveys of interested clinical providers suggest that many of them will need to have access to personal protective equipment that exceeds their current level of access. But again, it would not require people to have any types of symptoms or anything like that.
Okay, thank you. Bennett? Washington Post?
Hi, thanks for taking my call.
Yes.
So today, DC reported 15 deaths in one day. This is the single day high, matching April 14th. And we're seeing the racial and geographic disparities in deaths growing. So Mayor, what's your reaction to these deaths, and what trends are you seeing in who is succumbing to the virus in DC?
I think you asked me that question on Monday, and the answer is the same, that we continue to be very focused on our vulnerable populations. We're very concerned about our elders in congregant settings. We're very concerned about the people that we support in homes who are developmentally disabled and who live in smaller but still congregant settings. We're very concerned about our hospital, in our jail, and our homeless service facilities, so that we continue to think that our vulnerable populations are a huge concern. More than that, we are concerned about people who have underlying conditions, who will also could possibly not have very good outcomes with this virus. So people who have high blood pressure and asthma, and diabetes, and everybody, especially who falls in those categories, who's over the age of 65. And that is why you see us asking those people to be very aware of how they feel, to reach out to their providers, and to get tested.
Then I have two more questions. How can the public see how DC is spending federal COVID-19 relief dollars now, and does the district have any plans for making that spending transparent?
Sure. I mean, I think all of what we spend is transparent. We're certainly operating in an emergency and using our funds for emergency purposes. Some of those things have already been outlined in the emergency drawdowns that we have made.
And should DC have done more to lobby for Congress to treat the district as a state and give an additional $700 million plus for relief funds? Like, should your administration have been asking DC residents to call McConnell's office or ask Hogan as a Republican neighbor up north to be outspoken about this?
I don't know that anybody, and certainly we didn't get that word from our Congresswoman, would think that the district would be treated any differently in this response than what it is treated as in every other federal funding formula.
But could the district have done more to address this with the latest round?
Well, the district has done a lot to address this in this round, and as I mentioned, when I can speak for myself, and certainly everybody in leadership can speak for themselves. But we have been very focused on getting it included in this round as a fix. And I think what we see in this bill is it's focused on three things without any issues being addressed for states or localities. Yes.
Yesterday you came on our air and you said that you had seen the flattening of the curve in an amazing way. You used that word, amazing. But yesterday Dr. Birx at the White House said that she's not seeing the flattening of the curve in the DC metro area. Can you sort of square with us where you really believe we are here?
I can square with you where we thought we would be today, and that's with many, many more cases than what we see. That's not to suggest that we have fewer cases today than we did yesterday. So and I also said, we still have a long way to go. And that's why I have our public health emergency is in place until May 15th. We continue to look for 14 days of decreasing cases, and that's when we know we're getting where we need to be. Yes.
Program, I don't know if you or Director Bildar, how is it going, and is it sufficient? I know because you had said that if it weren't sufficient, you provide more resources. What is it?
Okay, so Sam's question is about our meal sites.
Okay. I think our meal sites are making an impact. We have gone above the 600 grocery bags that we're providing per day at the 2 sites that we do that. We went up to 750 last week. We tried to gauge it on the demand, so we're doing that and trying to get our numbers just right each day so we don't have excess, but yet have enough for those that need. So we continue to work those numbers. We did 600 yesterday, 300 each site. Our deliveries that we're doing to those that are in isolation and quarantine and can't get out continue to process. So I think, Sam, we're getting out there with it. We're still gauging the need, and we're doing what we can to meet that need. So that's where we are today.
751 day, or what was
Yes, last week we had, I believe it was Thursday last week, we had 750 between our 2 sites, so 400 at one and 350 at another.
Rebecca from the Washington Post.
Hi, Rebecca here from the Washington Post. Thanks for taking my question.
Yeah.
3 today. My first is that DC requires nursing homes to report all coronavirus cases and deaths. But I'm wondering, how is this enforced, and do facilities face repercussions for failing to do so?
Dr. Nesbitt.
So we have a number of mechanisms by which we enforce requirements for nursing homes, and they're embedded in the DC code and our regulations for healthcare facilities. We are in constant communications with our healthcare facilities around these requirements and work with the DC Healthcare Association to ensure that these requirements are in place. What I can say is that during this time, we have had exceptional compliance and collaboration with our healthcare facilities, given that they are extremely concerned about the residents who are under their care and are seeking a tremendous amount of support and technical assistance from the Department of Health around how to decrease transmission in their facilities, and are being more transparent around these issues. So I would not have a concern that they are not reporting these cases, and that the clinicians who provide the care there would be subject to punitive things for their licenses, which are not related to the operators of the healthcare facilities. The second piece is that in addition to the state licensure requirements, there are things connected to their payments that largely come from Medicare for operating their facilities, which would essentially shutter their facilities after the pandemic. And so there are a number of enforcement tools that are in place.
And I think, just to add to what Dr. Nesbitt has already said, I don't think our experience with working with these providers is suggesting to us anything but cooperation. Correct. And compliance.
My second question is whether DC has any requirements for nursing homes to report cases and deaths to the families and residents there. If so, how regularly are they obliged to report to families? And again, my question on enforcement, how is this being enforced?
So I think I've answered your question about enforcement. There won't be any other response I can add to that. Under current DC law, facilities have to notify a family anytime that there is a change in their resident's condition. They have to notify the resident of any change in their health status. So a COVID-19 diagnosis would have to be disclosed to that resident and the resident's representative if the resident has one. The facilities may notify the resident or the resident's representative if there is a case of COVID-19 in the resident or in another resident or a staff member, as long as there is no disclosure of protected health information. And that's what's under current DC law. This week, the Center for Medicare and Medicaid Services published a notice of a rulemaking that will go into effect soon that changes the district's may, which is in our current law, to a must on a federal level. And we have communicated to all of our long-term care facilities and our skilled nursing facilities in particular that they should move forward with the implementation of that requirement. And that requirement is such that anytime that there is a diagnosis of an individual, a single case or a single occurrence of COVID-19 in their facility, that they must notify residents or the resident's representative within 12 hours of a single confirmed infection, confirmed within 12 hours. Or if there are 3 or more individuals who either are residents in the facility or staff members who have signs and symptoms of a respiratory illness. So I just want to make sure people understand that it is a confirmed case, and they have up to 12 hours to notify the other residents and the resident's representative. So we have asked our facilities to go ahead and lean forward and begin to implement that new CMS requirement.
Okay, I think it's time for your call.
Can I just follow up? Can you repeat the date that goes into effect?
It's a published rulemaking, so it has to become official by CMS, but we have asked our facilities to lean forward with that requirement.
Okay, Megan? WTOP?
Hi there, thanks for taking my question and then letting us call in, I appreciate it. First question is about the testing site. I'm wondering how Bertie Backus was chosen as a site, if it was based on need in that location, and if there's any more testing sites open in the near future.
That's the only site that we have to announce today. We continue to look for additional resources that may be able to help us with a mobile deployment, and so if we will announce that at a later date, and we think that this site gives us more geographic diversity with our sites, and it's also located right on the metro.
Thank you. Second question is, you mentioned, I think it was last week, concerns about having enough testing to be able to get to that phase 1 of the president's plan. Now with the testing that Dr. Smith outlined, do you feel a little more confident about moving more quickly towards a reopening? Or I just was wondering if it sort of changes the feeling heading into a reopening.
Well, first, we need more tests. We continue to procure more tests, but there's more that goes into the reopening than that. I think that's how I would answer your question. Annalisa?
Okay, but this...
Go ahead. I'm sorry, did we lose Megan?
Yes.
Okay, go ahead, Megan.
Yes. Well, this is Annalisa.
Oh, okay. I think I cut Megan off before she was finished. Maybe we'll come back to her. Go ahead, Annalisa.
Yeah, so thanks for taking my question. I just wanted to ask about Ward 8 because Treyon White had tweeted that his ward is leading in deaths right now with 29 deaths according to the latest data. Any thoughts on adding more testing sites there or maybe more outreach?
We talked about we've talked about the additional outreach that we are going to focus on people who are participating in our Medicaid programs, and it is going to focus on getting more information out to the community about testing, about calling their doctor, and about staying home if you have underlying conditions. So that additional outreach is underway. We have, I think you know, our main citywide testing site is in Ward 8, and we will continue to focus attention on how people can get there.
Thank you. My second question is, I had a resident recently who was concerned about social distancing. Are you seeing that everyone is following it all over the city?
I mean, I'm not sure how to answer that question. What was your resident's specific concern, the resident who spoke to you?
They were concerned that no one was social distancing in the area that they lived in.
Okay. If you can tell me more about those areas, I can tell you some of the things that we have been very focused on. And I actually see my observation. Now, clearly, I'm not in every square inch of the city. So that's why it's important if there are some places that need more attention, that people let us know where that is. But I do see people social distancing and wearing masks and only going out on essential trips. We have enlisted the support of MPD and the National Guard. There was a question asked about grocery stores and if people are appropriately wearing masks. And we're going to work with the management there and to deploy some additional resources to those entrances, all in an effort to remind people that we have to continue to be in this posture until we see improvements with the level of infection and growing infections in our city. And then and only then can we get on the other side of this pandemic and start to get back to normal. So that's what I would continue to remind everybody. And it's also a good time because we've been doing this, and perhaps this is what this resident was seeing, is we've been at it a month. And maybe people start to get a little bit more relaxed and they're not as vigilant on day 35 as they were on day 1. But we have to be as vigilant about staying home, about washing our hands, about not going out if sick, about listening to our bodies and recognizing if we don't feel well to reach out to our providers and get tested.
Thank you, Mayor.
Megan? Is Megan there? Okay, we lost her. Maybe she can follow up with us. She had a second question.
And then Martin Astoril from WAMU had asked, he texted whether there will be public engagement around the budget process.
And I've talked about this as well, that we are waiting Friday to get our numbers so we actually know what we're working with, and we have a commitment to deliver to the budget to the council, I think on May 6th, and that we're working very hard to do that. And I've asked my team to work into some of these briefings, some updates by cluster about May 12th. Is that when okay, they adjusted the date, good, to May 12th. So we will work into some opportunities in these briefings to talk about different budget matters. And I expect as well that the council will have some budget, some public input on the budget at the council. Okay, thank you, everybody.